Hope you're all doing well and safe. Welcome to this webinar. I'm Rajnandini Rathod, Research Associate and Psychologist at RehabPath India. We are a medicine-based startup with a mission to help patients and families struggling with addiction to connect them with the right rehab center. We work with around 1,700 rehab centers all across India. And in today's webinar, we will be discussing the role of family therapy in managing addiction. And our guest speaker here with us is Dr. Vikas Bhateja, who is a consultant psychologist at Indus International Hospital and also runs a rehab center in Chandigarh called New Life Foundation. So this is going to be about a 1 hour session. So feel free to drop your questions at any time. We will address them at the end of the session. So before we go ahead and start with the topic, could you tell us a little bit about yourself, Dr. Vikas?
Thank you so much. Well, I'm Dr. Vikas Bhateja. I'm a licensed rehabilitation psychologist with RCI. I have done my PhD in cognitive psychology, and I have an experience of 25 years with the people, those are addicts. And right now I am consultant with the Indus International Hospital, Chandigarh. And we have an organization that is a New Life Foundation, where we work on addicts and various addiction units, like with their de-addiction programs.
Okay. So you've been in this field for a long time now, so you must have had like a lot of experience. So I'm really excited to take this conversation forward with you. But before that, could you also tell us about New Life Foundation and what are the services that are provided there?
See, when I started this project of de-addiction, I have seen that there are lot many lacunas and lot many issues with the addiction centers. And the major fault which I observed in most of the centers, that they were not promoting family counseling. And I, in my study, because my area of research in PhD was PBL, problem-based learning. So I thought that unless until all stakeholders, they actively take part in the process, then only we can work on the addiction of an individual. So here I was feeling that it is a very stereotype kind of atmosphere. Like we keep people, we just nourish them. A few of them, they do a kind of counseling which is not proper. So then I started this New Life Foundation, and I emphasized the scientific part of rehabilitation. With that, I introduced a lot many things, and the major thing which I involved was cognitive behavior therapy. And I felt that with CBT, you can really do miracle in de-addiction program. So this is how I started. I included CBT, I included family counseling, I included play therapies, and I picked up the approach that the client himself should be the director of his own program. Like when I meet an addict, I tell him that you are the driver of the ship. You have to drive. You have to take us wherever you want to. So this is how we did really. And this ultimately happened like this program really picked up fast. Everything went well. So the program was really nice. Everything went really well. I'm sorry, there is an
There's a power cut.
there's a power failure, in fact.
Okay, no problem. Yeah, I guess
Is it okay
it's
now?
better. Yes.
So we really emphasized on this program that what best we can do with all these things when we edit. We really felt that there is a good change in the mindset of the people, and people started responding well. When they were given responsibility, they acted responsible. Things changed, and everything started going fine. So CBT, family counseling, play therapy, I included 3 things in my program. And I put the client on the top slot. Like you have to deal with all the things. Like in a routine setup, like we encourage stakeholders. But in my program, I encouraged the addict to carry on with the program, because he was the beneficiary, so he was to take the initiative. I experimented it, and it went really well. So 25 years back, I started this program like the way I'm telling you. And till date, whosoever comes to me, I just tell him, please suggest how we can help you. So he suggests his remedies.
Okay.
We never try to be smart. We never try to be like good in front of him. We feel like that you have to show us how we can help you. Right? So when this is a natural phenomena, that when you give responsibility to someone, so someone start feeling the same way.
Right.
Like even to the child, if you give him a kind of responsibility, he will start acting like a mature person. So this is how you need to start. This is how you need to act. This is how you need to behave. So this is the main sequence of my program.
Okay.
That I put the client on the higher seat.
Right. Okay. So clients are given more authority of like designing their own treatment program, and the scientific methods like CBT, which is getting very popular now, is used more in New Life Foundation, from what I understand. Yeah.
I'm sorry, I'm not able to listen. You can you repeat?
Sure. Can you hear me now?
Yes.
Okay. Yeah. So I was just saying that in New Life Foundation, it looks like the clients are given more authority to, uh, change their treatment program if they want to,
Yes.
or curate it.
This is their option, how they have to go.
Right.
This is
And
their option.
okay. And CBT and family therapy are given more importance than they usually do in other rehab.
Obviously, yes, which is quite uncommon.
Right. Okay. So you've already mentioned family therapy, which is also going to be the topic of our webinar. So could you
Absolutely.
tell our audience first what family therapy is? Because a lot of them might not be aware.
See, we people, we have families, but we do not realize the importance of the family unless until we get into a trouble. So the story with the addicts is that they never give any eye to their family, any ear to their family. They don't bother. But once they get into a trouble and they get brought to a rehabilitation center, then the first thing they realize is the importance of family. From that moment onwards, they start talking about the family. that I'm missing my mom, I'm missing my father, I'm missing my wife. So from here we see the importance of the intervention of family itself. There is a difference between family therapy and family counseling. In family counseling, we simply counsel the family that how they need to behave in the given situation. But in a family therapy, we make the family a tool for intervention. I mean, we use family as a tool, basically. So that is family therapy. That means we take the family members as stakeholders and we ask from the client that how can he be benefited from his mother, how can he be benefited from his father, how can he be benefited from his wife. And suppose now if he says that I'm not happy with my wife, so again we are supposed to ask that how do you take wife in the de-addiction program, what role she should play. So then he tried to explain his way that yes, he should that the wife should support me, he should be given a space, he should be given a kind of atmosphere to grow. Wife was doing this, wife was creating this hurdle. So I mean, this is how he is creating the importance of some family member into the program.
Okay.
So then we sensitize the particular family member, like we call the wife, we tell the wife that, okay, this kind of wife he is expecting. And we are very sure that if you be like the wife he is looking, so definitely he will be having no option then after to change his mindset. So we take wife as a tool.
Okay.
We give necessary instructions to the wife that how she need to behave with the person. So this is how family therapy works, you see, in de-addiction program.
So the goal is to remove any conflicts and see how the family member can support the client in this case. Are there any other goals that are accomplished through family therapy?
See, we only that my point is very clear that family is responsible for the addiction of the individual. I mean, we cannot say the person is responsible for his addiction. No.
So the root cause is somewhere
We,
related to the family.
yes, we take family as a collective responsibility. I mean, family should not take like he is drinking, he is taking drugs, so he needs to be treated. No, the situation need to be treated. The circumstances need to be treated.
And the whole family is involved in the
The whole family, if at all. Now, if wife is not talking to the husband and we expect husband that he should not take drugs, so how it is possible? So the son is jobless and mother is asking that he should not take drugs. If he is not doing anything, so he has no other option than to sit idle and do things like this.
Okay.
So family plays a great role. I mean, we cannot make like this. Yes, okay, this thing go like this. No.
Right. It is
Family,
popularly said that addiction is a family disorder.
yes, absolutely.
Okay. And who all can be involved in this family therapy? Like which
See,
members of the family?
any member, like any member who is even we involve cousins. Like sometime we see that the person is not connected with the family, but he is well connected with the cousins. He is well connected with the distant relatives.
Mhm.
So when we are doing a therapy, so we can take them as a tool. I mean, we should not see that he should be a blood relative or something like that.
Okay.
If he is listening to the cousin should be brought into the program.
Okay. What about other children? Will they also be brought if there are minors in the family?
No, see, we discourage minors basically.
Mhm.
We don't involve minors this way because there are certain legal issues also with the situation.
Right.
And I personally believe that if someone is minor, so he should be in the custody of his parents or other custodians, natural custodians. So I do not advise any of the rehab center to keep minors.
Mhm.
If they are going to keep them, they should have separate family rooms where family should stay with the minor.
Mhm. Okay. So anyone, even if it is distant relatives or cousins, as long as it is relevant, they can be called and involved in the family therapy
Yes,
session.
absolutely yes.
Okay. So,
Girlfriend, even the girlfriend.
okay.
I mean, if he is having faith in the girlfriend, even if he's having faith in like this some fancy or something, so we can just take them because this is a rehabilitation program. So where he is emotionally connected, things will be much benefited.
Mhm. Okay. And who can provide this family therapy? Is there like a particular certification or license they should have, or which professionals can people go to for family therapy?
A person should be either a clinical psychologist or a rehabilitation psychologist with a valid license from RCI. One should not do like I have seen people with simple master degree, they are just doing these kind of counseling. If a person lodge a complaint and you are not having a license, so you can be in trouble.
Mhm.
So if you are licensed, then only you need to intervene. Or second is that you should work under a licensed therapist so that you should cover yourself before you do something. It is not a question you can do good or you cannot do good. It is a question whether you are certified for this program or not.
Mhm.
So once there is a problem, like I tell you, a person who is licensed as a doctor and a person who is quack. Sometimes quacks they have a better you see clientele. They are good, considered to be good doctors.
Mhm.
Is having those having no degree and all. But again, when litigation part comes, na, so they will be charged with the layman, you see, offense.
Okay.
They cannot be protected under any point of law. So they'll be taken like a normal person. Otherwise, your license or your degree can protect you.
Okay. So people, if they are looking for family therapy, they can check what certifications the
Their certification as well. Absolutely, yes. Or they should, again, there is a provision like there is a scarcity of people. We have very less licensed psychologists. So
true.
in that scenario, I advise that you should work under a psychiatric setup or some clinical psychological setup or rehabilitation psychological setup. So you should make their science uh, into the form whatsoever you feel.
Okay. All right. So, Dr. Vikas, you've been in this field for several years now, and I'm sure you've also been through a lot of family therapy sessions. So, could you give us an idea of what kind of issues are dealt with in family therapy? Like, just if you could give us some examples, maybe.
See, whosoever is coming to us is coming with the first complaint that I am not being cared by my family. My father was not attending me, my mother was not attending me, my wife was not attending me, my brother was misbehaving with me, even my children, they are not caring for me. So here comes the role of the family. If a person by himself says like this, so we can well understand the importance of the therapy. But my point here is different, that once the person come, we first of all check that what is his scenario, how he went into the process of addiction. Then we try to check and we try to relate it with the present situation. Like even we say that now you do not have a family. Your family was not good, but you do not have a family right now. Are you happy with that? So no one says like this, yes, I want to live without family. He says this thing that I want to stay with the family only, but on the contrary, I want my family members to be supportive. So even in the addiction centers, addiction programs, what happens that I mean, they were having a very bad image in the family. So family just reject them like anything. So when they jump into the de-addiction program, again, families got them admitted, you see, in the rehab centers, and they do not try to meet. Even rehab centers, they discourage family to be as a stakeholder. So here the problem is coming. We need to be very precise and particular with one thing, that family should play an active role. Like I tell you one case. There was a person who was saying that my wife is not happy with me, and we were not having a good marital relationship. So that forced me into alcoholism, right? So now I stopped working on the person. I started doing counseling with the wife. Wife was having her own complaints. She said that he consumed alcohol and beat me regularly. Now, here, when you find the situation, so you have to work more on the wife initially to make her very clear that now, remember, you are living with a patient. An addict is a patient. Do not consider him as a normal, healthy human being. He is a patient. So with the patient, one should deal the way you need to deal with your husband. So with the counseling, this effect comes then, yes, I need to work on my family. I need to work for my husband. So here comes the whole thing. So then we work on the person. We tell the person that, yes, we have already counseled your wife. Now she is taking up the responsibility, and we give him a kind of assurance, and then we make a family counseling. Now we include both husband and wife. We made them sit together. We made them chat for as long as they want. And ultimately, wife made wife makes him convince, okay, just don't worry, just come out of this and we'll be leading a very happy life. Now I understand you much better than before. Don't worry for anything. You come out of your program and then we are going to lead a very happy life, as we sensitize her for. So this is how the program works, you see. So almost in every case we do like this.
Okay.
In cases like heroin or this smack or these kind of opiates, so definitely it's a bit difficult, because we have people with personality disorders, conduct disorders, antisocial. So again, it is very difficult to, I mean, because they already lost the faith of the family, the trust of the family. So it is very difficult. Job gets tedious. But what I understand is that through family only, you can make the program of addiction very effective. Otherwise, it is just half done only.
Okay. So, like you mentioned, that a lot of rehab centers do not have family therapy or don't focus so much on family therapy. So, how does it benefit the clients, and what happens if they are not given family therapy?
If a person in the program does not get the family therapy, so one thing is very clear, that there are probable chances of relapse, because he will jump into the same situation where he was earlier. The circumstances remain the same, so he will not be able to pick up that way. And so far as I mean, people, those are not involving family therapies. So even they will be convinced on this point, that patient keep on coming to them. I mean, it is a routine practice. Then they get relapse time and after, and they keep on coming again and again, and this problem remains that way only.
Okay. So we have spoken like in detail about how it helps the patient and how family members can support them. But does family therapy in any way also benefit the family members who are involved?
Definitely yes. I mean, now consider a mother who is very much depressed. I mean, this is a real shock for the parents, that their child is a drug addict,
Right.
or an alcoholic. So once they are being involved into the process, so they feel very happy, they feel very confident, they feel very cheerful, that yes, now things are happening other way around. We are playing a very positive role. So this is their confidence which works, because when we do not involve the family members, so then they act like audience. Okay, give us the report, tell us what happened. Now once you let the family know that you have to play an active role, rather you have to help the person coming out of this problem, so they will be more
Responsible.
Responsible for the program.
Right.
Otherwise, everyone try to escape. Like I tell you, a common stigma I just want to discuss, that a brother brought the addict my center. What happened was that of course, brother was saying that yes, I want that he should be fully recovered and all. But later on, I found that brother was not taking any interest, because he was his elder brother, 2 years elder to him, and he was unmarried. Now, somewhere in the conscious, subconscious state, he was feeling that the moment he will die, so I'll be having the whole property in hand, the whole business in hand. So one handicap is that, first handicap is that he is unmarried. Second, if he is no more, so I'll remain the owner. So the brother was acting in a very different tone. He was showing responsibility in a very irresponsible manner. So in one sitting, I made him very clear that are you serious with your brother or you're just passing time? Then he said, sir, we are just sick of him. We want to get rid of the whole thing. And I mean, we are just done with this.
Right.
So now in this situation, the role of therapist becomes more particular. So he has to show a kind of responsibility. He has to set an example that yes, property will definitely come to you. Maybe some more things will come to you, but you will lose a brother forever. Right? So you cannot buy another brother with money. So here we also sensitive. In this case also, I just had a good counseling session. I applied REBT in that session. So the person then started acting responsible. He rather started bringing his wife. And later on, we found that the elder brother even left the drugs. He got married. Now he is very happy with the family. He is having kids also. So now when this brother usually come to us for some occasions like kids' birthday and all, they used to come. And I tell them, now you are rich because you have a family. If you happen to be alone and having crores of rupees there, that's of no use. And they're realizing. So this is the responsibility of the therapist, the responsibility of the psychologist, and the responsibility of the rehab centers to make people aware about the human values.
Right. I think family members are usually so tired of their behavior and also the stigma that is attached to addiction.
How can you expect from others, even if you're tired, if you as a family are tired, why other people they will take interest? That is my question.
Right. And I think
I
this
mean, if
must
your
be
own people are not taking interest, why you're expecting from other people that they will I mean, this is bizarre.
right.
At least you should come. So this here is the responsibility of the therapist. This is what I'm telling you. That we need to sensitize the family. Okay, let us start from here. Forget he is taking drugs, he is taking drugs. Forget he is bad, he is bad. Let us start from alphabets.
Okay.
Then we'll comprehend the whole thing. So they really, they admit even at a stage they start realizing also, sir, yes, this is how this program should go.
And I think this is something that you must have seen very commonly within the families.
I mean, you see, even wife, it appears that she wants to get rid of the person. That keep this person with you only. Give him some employment here only. I said, what about your kids? I'll take care of my kids, but I don't want him to come back. So see, I mean, this is not the fault of the woman. This is the fault of the social system.
And the
where
separation.
first
Yeah.
of all we encourage drugs, and then we do not encourage these kind of things as a remedy. So I can understand a woman who is not having any sport from anywhere. There is no particular program where she can go and seek sport. So here you can well understand that the lady is expressing her frustration. We should take this as that way only. Not like, yes, okay, go and take this out. We are not interested in you. No.
Yeah, so there must be many of these cases where the family members are reluctant to come for therapy, right? Like they might just refuse to come for sessions. So
This is
how do
the
you deal with
art,
that?
this is the art of the therapist to intervene. I impress people. Even I remember in a case, there was a person who was left abandoned by his wife. She left him 4 years back.
Okay,
She left to another destination with 2 kids.
okay.
So we approached the lady. We requested that please come at least for once. So reluctantly, I mean, she came. But the whole thing was that that lady started saying, I'm not interested, I'm not doing, I'm not. But not only the lady took part in the program, and they were united also.
Wow, okay.
What is your role as a therapist? Don't act like a normal layman. As a therapist, you have to show miracles in your career. It's not like that you do formalities only. Okay, family therapy done, motivational enhancement therapy done, relapse program done, sportive psychotherapy done, family therapy done, follow up regular, sign, okay. And the person is staying nowhere. Your documents are full. Your file is complete. Everyone played a role, but result is zero. So it should not happen like this.
Right. Okay. So, like we've been talking about how the family reacts to people's addiction, and there is clearly a lot of stigma that's there. Could you like tell us like a little more about how do you deal with that stigma? Like how do you educate these family members?
I always say that addiction is a social problem, first of all. Then it is a medical problem. A
Right.
person who is an addict is a byproduct of society. He has not come from moon or Mars. He has come from our society only. He is a victim. He should be taken as a deprived person. So here we need to start this way only. Number two, what feeling you carry, you should transfer this feeling to the family members. They may be reluctant, they may not be reluctant, they may be very much reluctant initially, but you need to play a role here.
Right.
So I am not interested in the history taking of the individual. I am more interested in one thing, that the person should come with a program as a family.
Right.
So this is a failure basically when you take the family away from the whole situation.
Right.
So I spend 10 to 20% with the client. I spend 30 to 40% with the family members. I spend 10 to 15% with the stakeholders, and I spent 5 to 10% with the team.
Okay.
That I make the role clear of every person who is involved in the process. Even we tell the psychiatrist that whether something is needed, there is any psychopathology, so medicine should be given.
Right.
Even we should have an empathetic nurse. We should have an empathetic staff. And the person who is not acting good should be made, acting good.
Right.
So this is how we need to do.
I'm sure like many of your patients must feel validated like for the first time in their lives and feel accepted in an environment.
They really feel good. They become my friends. They feel really, really good with everything.
Okay.
They,
So yeah.
they feel very good with everything. I mean,
So
sorry for the inconvenience.
no problem. That's all
There
right.
was a major power failure.
Okay.
Really sorry.
That's all right. I was completely involved in the conversation, so it didn't really. Okay, so like you have been in this field for so long now, and you said that you started New Life Foundation because you realized that a lot of rehab centers are not giving this enough importance. So how common is family therapy in rehab centers? Sorry, your video went off.
Just go ahead.
Sure, sure. Yeah. So I was just asking you, like you said, a lot of rehab centers do not give importance to family therapy. So how common is family therapy in India really?
No one is doing, honestly, except very few centers. They are actively doing it. No one is doing. If people, they say they are doing, they are not doing it in a scientific way. Family is a scientific tool to the de-addiction program. Is a scientific tool. Now I raise a question to you even, that suppose you have an issue, who can best support you? It's your family, or it's other in the society, or it's the doctors.
Like the family.
You go to the doctor without the family members. You get admitted somewhere without the family members, and you get somewhere or go to the doctor with family. You will definitely feel a lot of difference.
Right. Okay. So, Dr. Vikas, that's all the questions that I had. Can we move ahead and take some of the guest questions? Yeah, can you hear me?
Yeah, hello.
Yeah, okay. So there's one question someone has asked. Are families allowed to stay with the patient in the center if required?
I'm not hearing you properly.
Yeah, can you hear me now?
Yeah.
Yeah, so there's one question asking, are families allowed to stay with the patient in the center if required?
Yes. Your question is that they should be allowed to be in the center?
Yeah, they're asking if they are allowed to stay in the center.
Family members, see, there are two kind of admissions in rehab centers.
Okay.
One is voluntary and other is involuntary. Okay. So we have very few voluntary admissions.
Okay.
Most of the admissions are involuntary. And even the person is feeling that the family is responsible for the whole thing.
Right.
You have a legal right to talk to your rehab center that we need family therapy as on regular basis. They may try to convince you that he should be kept away from the family. He will be better learning the whole thing. No. He will be learning better if he will be kept in the family therapy. But there is a difference. Involvement of family members and family members as a therapy.
Okay.
When you are doing family therapy or family counseling, here you are not involving family as a system. You are involving them as a therapeutic purpose.
Okay.
You know, a person is saying, my mother, she never attended me nicely. And now you made the mother aware of how to deal with this child right now. And now she is dealing with the son effectively. So you will definitely get a change because the question has an answer now. So every rehab center should have a family counseling clinic where they should put the person in front of the family on different occasions in the presence of a professional, so that he may take best advantage of the family for the intervention of the addict.
Okay. All right. I guess that answers their question. There's can you hear me clearly?
Yes,
All
please.
right. Okay. So there's another question asking, is family therapy also provided after a patient is out of the rehab if required, just like relapse prevention?
In our New Life Foundation, we give free of cost family counseling forever.
Okay. Wow.
Once the person comes after some time, after 2 years, and need a family counseling or a family therapy, we provide it free of cost. In our clinical setup, we are charging 2,000 rupees per hour. But we just try to reward the person. Oh, you have done a great thing. Now you are just doing well with your system. Okay, we are going to give a reward. You will not be, you're not supposed to pay anything. We just offer tea, snacks, and then we do therapy also. We do not charge anything. So
Wow,
this
that's
is
amazing.
how the rehab people, they should behave to make it more effective. Otherwise, who will come?
Yeah, I think that's very
Once you are
effective.
out of the center, who will come? You just let me
Yeah,
know.
very effective
Free of
relapse prevention.
course, so definitely people will come that, okay, we'll meet, we'll see. Even they bring sweets also for other inmates. They bring fruits also. Oh, we have come, give us therapy. We have brought fruits also for those are under rehabilitation. Yes, we give them. So, I mean, if you feel like if your budget doesn't allow, you can just charge, but charge very nominal, like 500 or 1,000 or whatsoever.
Right.
Encourage people. This is very effective.
Okay.
And even we make it very mandatory that people, they should call us time and again. On phone call, they should be with us. So people, their families keep on calling us. How are you, sir? How things are happening? Yes, we are really missing the program. There was a lot of fun, lot of things. Because we give priority to positivity in our program. A person was not happy, not contented. That is why he went into drugs. Now in our program, he should be made happy first of all.
Right.
He was deprived of a kind of communication, connectivity, relationship. We should provide him the connectivity. We should provide him the affinity. So you have to behave like a family once you get the person in the program.
Right. Yeah.
And we call them family members only. Suppose we are 30 people in a program. So we are a family of 30 members.
Okay.
We make one the head of the family. We make one the responsible for the kitchen affairs. We make one for the responsible of recreation. We give these kind of tasks.
That's amazing. It becomes like a community then.
It need to be like a communion only.
Right.
I mean, don't put the people inside, make them stay for two. No one ever said to me that he feel like he is imprisoned. This is the compliment I got out of my career. No one said like this. And people, when they go, they were having tears in their eyes. Sir, we'll miss you like anything. Now you are in another family to our program.
Right.
So this is your win. If people, they are running rehab centers just for the commercial purpose, do not do this. This is not going too far. You are not going to get benefited because government is getting strict day by day. There are number of rules, a number of legalities coming. So be very, very particular that you need to be empathetic, positive
Right. Okay.
with the program.
All right. So I guess it's also almost time. So maybe you can just answer one last question, which is, can family therapy be done online?
Yes. I mean, I have a case. The person was in Canada. I gave him the therapy, this CBT. First of all, I started with normal counseling. Then I added supportive psychotherapy. Then I added CBT. So he found CBT very interesting. This is a notebook kind of thing.
Right.
You might be aware of. So he was writing things at its own. You see, he was very happy. Then I put the family. It was today when the technology is at rise. Why not we take the benefit of it?
Right.
Recently, I have never met with the person, but he is going amazing. His family, they are just planning for India to meet me only. That's it. They say we do not have anyone there, but we feel that we have at least one relative over there in India. So we'll come only to see you because we got benefited. So it is available online. It is available even on the phone call.
Okay.
You need a good voice. You need a positivity. You need good vibes to convey. Simple as that.
All right. Okay. So I guess that's all the questions that we'll be able to answer today. So this was a very insightful session, honestly, and I'm sure that it's going to help a lot of people who are listening and who are in our network. So can you share a message with all our listeners that you have as a mental health professional?
My message is one and very simple, that every person has a right to live a life of joy and happiness. And as family members, we should encourage each one in the family for that joy and happiness. So, unfortunately, we are leaving our family aside. We are trying to make others happy. Start from your family only. Family is a strong structure. It is a strong institution. I always quote कि there is a two lines I want to share with you also. कि भीगी हुई आंखों सा समंदर न मिलेगा, भीगी हुई आंखों सा समंदर न मिलेगा, घर छोड़ के मत जाना कहीं घर न मिलेगा. So I always say कि family is very, 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 very precious for all of us. We need to remove the barriers in between which we create, unfortunately, and we should act like a strong member in the family, and we should act like a torch bearer.
Okay. That was a really sweet and inspiring message. So once again, it was really good having you here and talking to you. And
I'm really sorry that some power failure took place. I couldn't organize, and I was very busy today. But see, this is like a very refreshing kind of thing, and this power failure make a bit inconvenient. I'm really sorry.
No
For
problem.
that.
I think our conversation went
It
perfectly
went.
smoothly.
Fortunately, everything went so well. But
Right. So I'd like to thank all the participants as well and for showing active participation. And we will be back again with another webinar soon. So until then, stay safe and have a great week. All right. Bye, Dr. Vikas. Thank you so much for joining.
thank you so much. Thank you so much.